Hi friends, this is Dr. Abdequaem Chimthanawala. Today I'll discuss a very interesting remedy, that is Sanicula. Of course, you must be knowing Sanicula in a different perspective, but I would tell you some symptom today which I have seen in lot many of cases and confirmed in lot many of my patients, and have got very beautiful results using those symptoms as the entry point of the case. Everybody remembers the symptoms of Sanicula like constipation and desires to be carried and all. Remember one thing, a Sanicula patient has a delusion that he is hated by others. उसको लगता है कि मुझे लोग पसंद नहीं करते, मेरे को लोग पसंद नहीं करते, इसलिए मैं क्या करूं, वो खुद ही अज्यूम कर लेता है. Assumption. He assumes a lot of things and that's why he feels that people hate me. And when you have this delusion that people hate me, nothing can give you satisfaction. इसलिए एक सिम्टम है, इसलिए what happens in Sanicula, the patient always needs to be consoled and always need to be have some positive commands, positivity from somebody. So he always has a good friend or a parent or a father or a mother or a husband or a brother, sister. Always keep telling me that you are good, you are doing so good, XYZ. That's why, as a rubric, that desires to be nursed all the time. Now you can take this as rubric. Maybe a child always wants the mother's breast, milking breast, and he is happy with that. When the child takes out when the mother unweans the child has all the symptoms. You can take this also and this also, that desires to be nursed all the time. हमेशा उसके साथ रहना पड़ता है, बोलना पड़ता है, उसको कॉन्फिडेंस देना पड़ता है कि ठीक है, सब अच्छा है, तुम अच्छा कर रहे हो. So delusion, being hated by others, is a very important entry point of Sanicula, and that's why we have symptom that desires to be nursed all the time or carried desires to be constantly. In here also you can take desires to be carried in children's, like we have Senna, we have Chamomilla, we have Antimtat, we have Sanicula also. Desires to be carried every time. But nursed, that's Sanicula, and that's why desires to be always given a positivity, that is Sanicula. So this is a very 3-4 rubrics which you have to understand in Sanicula. And that's why the patient has the symptom of clinging children of downward motion, clinging at downward motion. That's a very important symptom of Sanicula again. That's why Sanicula patient, whenever he goes to a doctor, whenever he wants to do some examination, he feels that he has a lot of fear that what will happen, my reports will not be good, then I'll have this problem, I'll have that problem, what will people think, people will not like me. And that's a very important, again, a symptom of Sanicula, that what you call fear before a medical examination. These are the very, very important entry points of Sanicula. Do remember the symptom delusion, hated he is. With this symptom, with this assumption that I have hated, there may be lots and lots of symptoms, lots of peripheral symptoms of Sanicula that you can never imagine also. So this is the entry point, the core symptom of Sanicula, and that's why it desires to be nursed all the time, desires to be carried, downward motion problem, fear of medical examination. These are very, very important symptom of Sanicula. Of course, do add the symptoms of what you call light stools and constipation. That's again a very important symptom of Sanicula. One symptom of Sanicula that I have seen in a lot of cases, that throws herself backwards. Whenever you come to examination and you're talking, he's like this, throws herself backwards. It could apply also in a state of convulsions or epilepsy. This is also Sanicula state. So these are the very, very important, you can say, metaphor rubrics of Sanicula that you have to remember and understand in your practice, so that you get better results in your practice. So my dear friends, if you like this video, do share and subscribe. Thank you.